Let's see if this works. Is this on? There we go. Welcome, everybody. We are at Stride here in Jefferson County. I'm really excited to be here with the Stride CEO, Ben Wiederholt, and the Chief Health Officer, who you're going to hear from in a minute, Dr. Savita Jinde. Stride was started in 1989 and really one of the great examples of testing. And what the main message we want to make sure we convey today is that we now have enough testing that if you have symptoms, you can get tested conveniently, near you, free, including here at Stride, which has tested over 10,000 people, and at over 30 community testing sites across the state, many local hospitals. Stride offered their first COVID test in mid-March, and they've continued to work rapidly to scale testing up. As a community health center, they've really gone above and beyond. They were telling me of the people who got tested here, only a small percentage were actually Stride customers. It's essentially community members who come. There's many who are getting tested even as we speak. And I'm going to get tested in a little bit as well to show people how easy it is. You remember originally when there wasn't enough testing, the message that we said is if you're sick, you just self-isolate. Whether it's COVID or not, you stay at home. That can still be your choice, but we are now encouraging you to get tested to see if it is COVID if you have flu-like symptoms. Now keep in mind that flu is mostly gone from our state, and it's a very low number. Because of the social distancing, there's not as much flu, which means that if you have those flu-like symptoms, there's certainly a higher chance that it might be COVID-19 relative to the flu or something else, because all those other conditions have decreased significantly because of your success in social distancing. We wanted to highlight one of the leaders in innovation in testing here today. You know, scaling up testing and monitoring is one of the key components of making sure that safer at home works in Colorado, right? The four key components: protecting our most vulnerable, the ongoing social distancing, wearing masks, and testing and tracing. Those are the four factors that are absolutely critical to our success in containing this pandemic, saving lives, and moving towards a normal economic activity and normal social activity in the months ahead. On April 29th, we gave an extensive briefing on testing capacity, and we set some benchmarks. We said that our goal was by mid-May to be able to test anybody who's symptomatic, and I'm glad to say we've reached that milestone. We are now testing in Colorado everybody who's asymptomatic who wants to get tested. It's free, there's no out-of-pocket, and whether you have insurance or not. And we encourage people who have COVID-19 symptoms to go ahead and go get tested. We make it easy, and it's available near you, and we've reached that goal. If you take anything away from today's briefing, it's this: if you have symptoms of COVID-19, consult your medical provider and get tested. Now, if you have a doctor, that's the most common route to getting tested, your doctor, your hospital. If you don't have one, if you don't have a medical home, if you're not insured, or even if you do have a doctor but can't reach them, all of the 32 free testing clinics across the state, including Stride, are a very easy way to do that. In addition to people who have symptoms, we also encourage other folks to get tested. If you're a healthcare worker, a first responder, an essential worker who interacts with the public, you're also welcome to get tested. So symptomatic folks, of course, we encourage you to get tested. You don't have to. You can self-isolate at home till you recover and have no symptoms for 5 or 6 days and then go out. But we do encourage you to get tested. And if you're an essential worker with regular contact with the public, particularly contact with the most vulnerable, we encourage you to get tested. As I said before, we want to get to the place where we're doing 8,500 to 10,000 tests a day. Last week we had a day where we tested close to 5,000. Between the state lab and the great efforts and our partners, we can process up to 10,000 a day. I'm really proud of our testing team. It's been an all hands on deck effort. And now that you can get testing, you really should get tested if you have fever, dry cough, shortness of breath. Those are the main symptoms, loss of taste or smell. Those are the main symptoms that we're seeing in COVID-19 patients. The common cold is a little bit different. it often leads to congestion, stuffy, runny nose. That can occur with COVID, but that's not the most common presentation of COVID. Stuffy head colds and being congested is much more likely to be a cold. COVID-19 is more likely to be respiratory, cough, shortness of breath, fever, but it can show those other symptoms as well. But getting tested is a real important part of our process of making progress against this virus, and we can now offer testing to everybody who's symptomatic in our state due to the hard work of medical professionals, the state, our partnership with private suppliers in Korea and elsewhere, our partnership with the federal government. And I want to make sure people know that testing is widely available. You can find out the 32 community testing sites at covid19.colorado.gov. Scroll down to the testing site. There's an interactive map. We're adding more on a regular basis, so there's one near you. And of course, at healthcare providers like Stride, where we are today, Children's Hospital, UC Health, Centura, Denver Health, National Jewish, Kaiser, and many other private providers. So if you are a customer at one of those facilities, if you have Kaiser, contact them. If for some reason you can't get it through them, come to one of the free community testing sites. In the last 7 days, the state lab has sent out 25,000 swabs, hundreds of masks and gowns and gloves. And you can go to covid19.colorado.gov and click on Find a Community Testing Site to find the site near you. We also have specialized testing sites with the Colorado National Guard at senior facilities. These are not for the general public. They're in addition to that. These are for people who work at the senior facilities. We've started with some of the largest, worked our way down. I've heard over email from several senior friends who live in facilities where the staff has been tested. Asymptomatic folks are tested. Anybody who tests positive, removed from the workforce to prevent infections at those facilities. There are also other private sector testing partners. Kroger's has run sites in Denver and Boulder and Greeley. Walmart is setting up 4 sites: Greeley, Fort Morgan, Aurora, and Westminster. We really want to make this as convenient as possible. And whether you have Medicaid or Medicare or private insurance or no health care insurance, cost is not a barrier. There is no copay. There is no out-of-pocket for testing. And that is an important message that I want to make sure that people know. If you have symptoms in Colorado, we are proud to say that we are now ready to test anyone with symptoms, and we do want you to get tested. If you make the choice to self-isolate, you can do that. Remain out of contact with anybody until 5 days after your last symptom departs. That last symptom could be fever, it could be a cough. 5 days after that leaves, you can go out. Or, again, if you want to get back into circulation sooner, you should go out and get tested, because you might not have COVID, and then you can go out right after your symptoms resolve. Or if you do, I think your loved ones and friends should probably know that so they can get tested too. We're in this together, and that means making sure everyone can get tested, particularly as businesses have been open for a few weeks now, people are back at work at the office. We need to continue to show that individual responsibility. That's what's going to get us through this. We can't go back to how we lived in January and February. We need to limit our social contacts, stay 6 feet away from others where we can, wear a mask when you're in public. The more Coloradans do that, the more we will suppress the virus and the more that our economy will recover rapidly, because the economy is about confidence. And it's about making sure that people know that the virus is contained at a level where they can go about their daily lives without putting their lives at a great risk. Now, Stride and others do 2 types of testing. What I've been talking about today is a swab-based viral testing. That's what in a few moments you'll see me be tested for as well. The other kind of testing is antibody or serology testing, or a blood test, okay? So for the swab test, Stride does it 2 ways. They do it with a swab in your mouth or in your nose. Those are the 2 ways they do the swab testing. The blood test is, for anybody who's had a blood test, it's just like that. They take a tube of blood, some take less than that, and then they see whether you have the antibodies. The antibodies are relevant for finding out if the body has had a response to the virus. Since antibodies take a while to develop, but they continue to show up, they will help say whether you had the virus. You may still have it, you may have overcome it. They're a tool for research, but it's also too soon to know exactly what antibody tests mean for individual patients. We expect that there is increased resistance from those antibodies. Scientists don't know the degree of that resistance. They don't think it's zero. They also don't necessarily believe that it's 100%. They believe those antibodies show stronger resistance. A person could test negative on an antibody test, but could still be spreading the virus because they have the active virus and they haven't developed the antibodies yet. They have the active infection. We're very proud to see partners in our scientific community studying this and learning more about the impact of serological testing every day. As we are rapidly going back to work, opening our economy and businesses, it's more critical than ever that we gather data and information, that if you're symptomatic, you get tested. The only way we know that is through virus testing, as well as the testing for antibodies, which we're doing as well. And it's wonderful that Stride is offering both options to people. And right now, we're really focused on getting as many nasal swab tests done as we can, both for asymptomatic folks who work at senior facilities, that are members of the essential workforce, that are healthcare professionals, that are first responders, but also for anybody, any member of the general public that exhibits coronavirus-like symptoms. So if you have symptoms, go ahead and get tested. You can use the online symptom tracker at covid19.colorado.gov. That'll help the state and public health response. And if you're positive, or if you're symptomatic and not sure if you're positive, make sure you isolate yourself to stop the spread of the virus. Now I want to introduce Dr. Savita Jinde, the Chief Medical Officer of Stride.
So Stride Community Health Center is proud to be leading the community response to COVID-19. Since early March, Stride's team has been working tirelessly on the front lines, keeping people safe and finding ways to continue to provide accessible services and care to anyone who needs it, related to COVID or not. We've been closely monitoring the CDC and the Colorado Department of Public Health's guidelines and recommendations to inform Stride's protocols for care, as well as the information and education that we provide to our patients. Since the outbreak of COVID-19, Stride has provided testing at multiple locations, including 2 public testing sites and a mobile team that has provided testing as far away as Park County. With the state's leadership in its push for testing, in alignment with our own efforts, we have completed roughly 10,000 swab tests and are seeing a 21% rate, a positive rate with the swab diagnostic test. On April 27th, Stride added the Quest IgG antibody test to its menu of services and has provided almost 2,000 serology tests to date. We're finding that serology tests are positive for antibodies in about 9% of patients tested. Stride is doing everything possible to enable patients to maintain social distancing and to remain at home whenever possible. Providing care remotely through telehealth has been key in this, and Stride has been able to address medical, dental, and behavioral health needs via our telehealth program. Additionally, Stride is actively supporting recently hospitalized patients with COVID. We are seeing individuals who have been released from an area hospital who are COVID positive and who need follow-up care, though they have not yet met criteria to be removed from isolation. In response, Stride opened 2 COVID positive pods. The Stride COVID pods are designated in areas that are isolated from our clinics. They allow hospitals to be freed up to focus on the patients who really need them. And the location of our pods are strategic in reducing exposure to our staff and our patients, while being able to care for our COVID positive patients as well. The resounding feedback that we have received from people coming through our testing locations is appreciation and support for the work Stride is doing of course in parallel to the leadership of our state. We've heard patients say things such as, "Everyone was welcoming. The process was simple. I'm so relieved." Another patient said, "I couldn't believe how fast testing was. It was very well organized. I would recommend anyone coming to get tested here." And then another patient said, "The Stride staff was extremely professional, well protected, and very informative. I cannot thank you enough for helping me to get this test." Patients are grateful for not only the opportunity to get tested, but for our follow-up and guidance on continued use of masks, on assistance in figuring out how long to stay isolated, and our help explaining the most up-to-date guidelines and recommendations. So we encourage anyone interested in getting tested or for information about our services to check out our website at stridechc.org. Thank you.
Thank you, Dr. Jinde. In a moment, I'm going to be tested, and I want the people of Colorado to see how easy this is. As a government worker who interfaces with the public, I meet the criteria, as do grocery store workers, as do first-line responders, as do people who work in medical care, or government workers who interface with the public who are asymptomatic. So just like others who interface with the public, who are in government service or work at grocery stores, I'm getting tested. Now, you don't need to if you're not symptomatic. You can, especially if there's an outbreak in your facility. It might be a wise thing to do. We really are encouraging people who are symptomatic to get tested, but there are many people who meet the criteria in healthcare, in senior facilities, and other areas that even if you're asymptomatic and if you have an hour or two, it would be a smart thing to do. Keep in mind that a test, though, is only a picture of a moment in time. And that's why with our program at the senior centers, we are developing ways where we go back and test the same people. Ideally once a week, might be every 2 weeks initially, because we want to continually screen out anybody who might have contracted the virus and test positive but be asymptomatic to prevent some of those outbreaks. So that program is rapidly expanding. I also wanted to talk briefly about restaurants. We will have the draft guidance on restaurants out tomorrow or later today for the general public to look at, for restaurants to start preparing for opening. I'm also encouraging all the cities and counties that restaurants operate in to look at their options for outdoor dining, for opening up sidewalks and streets. That's really the only way with the spacing that we're going to have a thriving restaurant environment for the coming months. Thankfully, Colorado has wonderful summer weather. 9 out of 10 days in summer are terrific for outdoor dining. With the reduced dining capacity in the actual facility because of the way the airflow works and how contagious it is, the way that restaurants can get to 100% capacity, even 150%, is by spreading out in their parking lot, their streets, the sidewalk. So I really encourage every municipality, every city to have that discussion with their restaurants. The state is going to waive every rule and regulation we can, including, like serving beer and wine on streets, anything else that gets in the way of restaurants doing that. But of course, it is the cities that control those. So I hope every city is thoughtfully doing this. If cities value having restaurants and keeping them in business as part of their quality of life, it's really important that they open their sidewalks, parking lots, and or streets in the next few weeks to have that capacity, because restaurants simply can't stay in business at a quarter or half capacity. So those guidelines will be out in the next day. Those are the draft guidelines. We are expecting comments from restaurants, from cities, from customers. We are still looking at the May 25th date for the final call. But whatever that date is of when they go live, these are going to be the way that restaurants can offer in a safer way that inspires consumer confidence, that you know that you can go out to a restaurant without a major increase in your likelihood of infection in a reasonably safe way. That answer is going to be outside. The data all from the health side shows the major difference in internal recirculating airflow in an enclosed environment and being safer outside, like you are all today. Those who are here are outside, and we are significantly safer if you're 6 feet apart from somebody outside than if you're 6 feet apart from somebody in a smaller area with limited airflow. So encourage cities to have that discussion with their restaurants. We want a thriving culinary scene. To be able to do that, it requires a partnership that includes sidewalks and parking lots, and in some cases, city streets, to expand that capacity to allow for greater spacing. So I'm going to be tested now. I was tested at the White House last week. It was a different platform, a different test. This test that we're giving Coloradans is far more accurate than the Abbott test that was used at the White House. The Abbott test used at the White House is one that we use in a targeted way in Colorado, but this test that we're making widely available for people has a much higher accuracy rate than the test that the White House uses. And everybody who gets tested should have their results back in 24 to 48 hours from when you get the test. You can go to covid19.colorado.gov and click on the community testing sites to find out all of the different places that you can get testing. That's in addition to places like Stride, hospitals, UC Health, Kaiser, Centura, all of the normal medical partners. So with that, we're going to go get tested. That's it, right? That's it. Very simple. Takes 10 seconds. Feels like, feels like a little tickle. And if you have symptoms, we want you to get tested. And if you've been an essential worker contacting the public, first responder, government worker, works in a grocery store, you can also come in and get tested. And we might be able to identify outbreaks earlier and prevent them from getting worse. So thank you so much for that test. And we'll look forward to getting the results. Thank you. So with that, we'll open it up to questions. We'll start with the people here.
Governor, you mentioned that the draft outline for restaurants reopening is coming.
Yeah.
Previously, you had said it might not be May 25th, coming sooner than expected.
Okay. No, I want to be clear. These are the draft guidelines under which restaurants can open because they need time to get ready. The date is the piece that we will not have till May 25th. So we didn't want to, on May 25th, say, here's what you need to do. That would mean restaurants couldn't open until a week later because they might have to move their tables around and change their staffing. So these are the draft guidelines. We will then, I'll give you the exact timeline. What these draft guidelines are going to be out today or tomorrow. We are then going to, over 2 or 3 days, take public feedback, finalize these guidelines by the end of the week, and then announce the date next week, May 25th, which we hope is then, based on the data holding up around the level of the virus in Colorado.
So you will tell restaurants how they can reopen?
Exactly. This is how they can reopen. The definitive when needs the data from the next week, which we don't have yet. So, but that's very important because you can't just tell restaurants how to open, and by the way, it's tomorrow, because none of them can actually open. They need a week or so, is what they've told us, to get ready. And so the how will be out by Friday. The draft is out today. It could change a little bit based on input, but the public health side is very strong and it looks good. I'm sure we'll get a lot of good input from restaurants and from customers about what we can do to inspire confidence. The key pathway for restaurants to be able to reach 100% or greater capacity involves the use of our beautiful outdoors in the evenings and during lunchtime. And that includes, already they have patios, but that includes sidewalks and parking lots. And then when cities can cooperate with them, they might be able to use parking or city streets as well.
Governor, you previously said that we had all this testing capacity. The issue was the reagents.
Yeah.
To what extent has that issue been resolved?
Yeah, so we now have enough, which is why we're highlighting testing today, to test anybody in Colorado who's symptomatic. And so as well as people who are public-facing, government workers, grocery store workers, first responders that are asymptomatic. So we have reached that threshold. That was our goal by mid-May. We're there. And so our message has changed. Last month, the message was, if you're sick, self-isolate unless you need medical attention. Now it is, if you have symptoms, you don't have to, you should get tested to see if it's COVID-19 or something else, if you have flu-like symptoms. If you choose to self-isolate, you can do that. But it's better for all of us, from information, for science, for containing the virus, if you go to a convenient testing center near you and get a free test.
Governor, the executive order you issued this weekend started to get some blowback. Folks who are behind the 22-week abortion bans accuse you of leaving them out for political motivation.
Yeah, so look, access to our ballot, while it's inconvenient for office holders, because as governor, I don't like many of these initiatives. Many members of the business community, leading Republicans and Democrats don't like many of these initiatives followed. It's not about us, it's about you. It's about the right of the people to petition to place something on the ballot. And because there is a public health emergency that makes the normal petitioning gathering next to impossible, it was absolutely critical that we honor the right of the people to place ballot initiatives on the Constitution by creating a way that is consistent with our constitutional principle of the right to petition and meets the needs of this public health environment. So I think we threaded that needle, working with the Secretary of State to create a way where people can submit those signatures by scanning them in digitally or mailing them in. And we look forward to working with the Secretary of State on the rulemaking. Obviously, no initiatives were separated out based on whether I like them or not. There's many initiatives that are going to be using this that I like and many that I don't like. It would be very convenient for a governor to shut down the initiative process and say, sorry folks, I'm going to take all the power and not let the people have it. I think what's most important though is we don't let our democracy be a casualty of this pandemic. And I believe that the people of Colorado have the ability to place initiatives on the ballot, and that's why we made sure that we preserve that during this pandemic, even if it decreases the power of the legislature and the governor. On some initiatives that gathered signatures before the pandemic, it doesn't affect them. So if they turned in their signatures before the pandemic started, then their signature gathering was not affected by the pandemic. There's some that have qualified that way. They're still on the ballot. There's some that have not qualified. There's others that are in cure periods from pre-pandemic signature gathering.
Yes. Okay, telephone question. From Biz West, last week the state revoked the license of a restaurant in Castle Rock. There are restaurants that have been operating after the county said it wasn't so. Oh, in Weld County, what's the status of the state's actions toward Weld County? Weld County has not taken any actions that I'm aware of in contradiction to Safer at Home. Any business that illegally operates is of course subject to losing their license. That happens in normal times. Restaurants always have hepatitis guidelines, they have health ratings. Any restaurant, a year ago, 5 years ago, 10 years ago, any restaurant that operates in a way that's a health hazard loses their license to operate. That's the way that we as customers know that restaurants are reasonably safe to go to. So, of course, that's true if they're not following COVID-19 protocols, if they're open illegally in an area that can't be open. Keep in mind there's a number of counties in our state where restaurants are already open. But if it's a county where they are not yet able to be open and they don't have guidelines to open and they're operating illegally and they're a health hazard, just as they would have lost their license, 5 years ago for hepatitis or salmonella, of course they would lose their license today for COVID-19. Adrian Thomas from KREX, what specifically are social distancing practices that will be in place for schools? Will this be statewide or will districts be able to make modifications? There will be statewide guidance. It will be implemented by school districts because it's a very different situation on the ground. Essentially, school districts are looking at ways that they can have their large congregations like lunch and passing times at different times for different classes. So the kids are mostly with the people in their class for most of the day. And then the classrooms themselves will be configured in a way to maximize social distancing to keep everybody as safe as possible. So we're working closely with the school districts, with the Department of Education, and with health officials on those protocols for school districts. And they will be out plenty of time ahead of the school year starting so districts can get ready. Just as with restaurants, we're going to have those out by Friday so that they can get ready for when they reopen. School districts will be out in the next few weeks so they have plenty of time before they go back in August to get ready. Ed C. Lover, can you provide clarity on when you will make a decision around restaurants May 25th? And next question from here. Yes.
Governor, so last week you started reporting deaths in two different ways. Can you clarify how you're identifying deaths among people with COVID-19 if COVID-19 is not on the death certificate?
Yeah, then they're in that higher figure if it's not on the death certificate. If it's on the death certificate from a coroner or attending physician, they are in the confirmed cause of death, COVID-19 category, 890 or so right now. If COVID is a contributing factor, but it's not the factor on the death certificate, then it's listed in the died with COVID category, 1,200. It's probably somewhere in between. It all depends on what you're trying to interpret for people. Are you saying people that have absolutely, by certification of a medical professional, died from COVID? That's the 890 number. Several hundred more died with COVID and might have contributed to their death. And then there's people that we've missed altogether that probably died from COVID that aren't included in any number because they haven't been confirmed by a coroner or autopsy. So, you know, the point is that we want people to be confident in this number. And there are unfortunately people that attack these numbers, and we wanted to make sure that we had the strongest possible defense by saying, look, a doctor, a coroner, a attending physician use their professional respectability and authority to say this person died of COVID-19, and no one, no bureaucrat or anybody else should ever change that to say they didn't die from COVID-19. And so that number is being reported along with the other numbers. The only number that's not reported are the ones we don't know about because we don't know about them. Yeah, we can test more because we've been advising people that, you know, that they should stay at home and self-isolate if they have symptoms. That's what we're changing today. You can stay at home and self-isolate if you have symptoms, but we are now encouraging you to get tested. So that's the change in policy today. A month ago, that wouldn't have worked because we didn't have enough tests for people that had COVID-19-like symptoms. So we said self-isolate, stay at home, assume you have COVID, even though it's only 20% chance you do. Don't go out until 5 days after your last symptom. Now we're saying if you have COVID-19 symptoms, you should get tested. You can stay home and self-isolate, but you should get tested. So yes, we are now ready to encourage more testing versus a month ago where we were unable to accommodate more testing. And that's due to the hard work of our testing unit, of our partnership with the federal government, private suppliers, South Korea, Stride, and so many others, the county health authorities, and so many others. Good follow-up? Well, that depends on whether more people come in or not. So you know, we are now ready is the point. A month ago we said if you're sick, you don't need to get, there's still no clinical treatment for COVID-19 unless you need to be hospitalized. I mean, they will send you home and say you need to just get better unless you need hospitalization and get hospitalization. But we now are encouraging people to get tested. And I do expect that, yes, people will respond to that. It's now easier, it's now simple, they now know it's free, and more people with symptoms will get tested. We have enough testing to test everybody who's symptomatic in our state, along with some of the essential government workers and first responders that may have been exposed. So we have that today. Well, we have the ability to process over 10,000 tests a day in Colorado. And the highest day we had was about 4,500 so far.
Governor, next week the General Assembly returns. I've seen a draft of a reinsurance bill that I'm told that you are in favor of. Can you talk about that?
Yeah, I mean, I can't comment on what draft you might have seen. I don't know if it's one that I saw, but reinsurance is critical. We have to make sure, especially with a higher unemployment rate, with less people having employer-backed health care next year, we have to make sure that we're saving people money in the individual market for health care, in the exchange. People can't lose their health care because rates go up. Reinsurance is absolutely a critical piece of that. Reduce rates statewide by about 20%. We absolutely need to maintain that.
Governor, do you support extending the program another 5 years as is indicated in this draft bill?
I'm supportive of extending it. I don't know the exact timeline. We will likely need reinsurance until there's another round of federal health care reforms that shore up the exchanges. So if Congress were to act with a new president and a new Congress in 2 years, it went live in 3 years, it's possible we could pivot towards a more competitive direction sooner. But I think it's reasonable to do it for 5 years. We can always change it to reflect any federal changes if that needs to occur.
Governor, the CPHE's form to actually get tested is very specific. It doesn't necessarily cover all the coronavirus that are on it. I think there are people out there who are not getting tested because they still feel like that they're not reaching the level. I wanted to go back and ask you guys see the curve of people showing up. Is this why we're doing this today?
All of those documents will be updated to reflect the criteria that I described to you today. If you're symptomatic, you can get tested. If you are asymptomatic,
and a essential worker that works with the public, you can get tested, and those documents will be updated as well. There will also be stronger advice to get tested, of course, for those who might be at risk of bringing the virus to others as well. So that'll all be updated. This is the first day that we're saying that we're ready for anybody who's asymptomatic, or I'm sorry, everybody who's symptomatic to be tested. And we expect that many people will react to that. So we expect that many more people will get tested now, knowing that we're no longer indifferent or discouraging and saying self-isolate. That we're now saying you can self-isolate, but we actually encourage you to get tested.
Governor, you said that more testing, the economy's not confidence, more testing equals more peace of mind for businesses. What's the correlation, though, between rising testing numbers and your comfort level with reopening various things? So,
Yeah.
10,000, what can you do that you don't feel comfortable doing today?
So first of all, and we should all be with more testing, the number of positive cases will go up. So I mean, I want to make sure people know that it's likely that the positivity rate, as we broaden the testing, might continue to go down, but we will certainly pick up cases that we have missed under the prior testing criteria. So the positive identification of cases will go up. That doesn't mean more people have coronavirus. It means we're catching a higher percentage of the people that have coronavirus with a confirmed test result. And yes, the testing and tracing, and we will have, I think we've given you a limited update on tracing and quarantine. We'll have a more extensive one soon. But that's the whole process where it's not just the testing. It's then about making sure that a county health official or other talks to you, finds out who you might have been in contact with, make sure that they then isolate or go in for testing themselves, even if they're asymptomatic. So that piece that follows it is really one of the key 4 pieces to how we contain this thing, rapidly open the economy, and get back to normal. The other pieces continue to protect the most vulnerable in senior housing facilities, nursing homes, wearing masks in public. There's no substitute for that because many people who have it are asymptomatic, won't be tested, have no reason to think they might have it. A mask will prevent it from being spread. And then continuing the social distancing, meaning staying 6 feet apart from others where we can, groups of 10 or less. All of those things are absolutely critical. But the testing and tracing is one of the 4 legs of that stool.
Governor, regarding hospitals, how long do you think they should maintain a high alert status to receive like a surge of COVID patients? And what about the overflow facilities that have been set up around the state to handle COVID cases?
Hospitals still have many COVID patients, thankfully. Thankfully, they have less than they do 2 weeks ago. It all depends on the behavior of the people of Colorado. If people stop engaging in social distancing and stop wearing masks, we're going to go back to worse than we were at the height of it in March and April. There's no question. The virus is here. It's in our community. We have community spread. If people give up on social distancing and stop wearing masks, the hospitals will be flooded, and we will need the additional facilities that we have at the convention center at the ranch. But I'm an optimist, and I strongly believe that Coloradans are being responsible. I see it every day. Coloradans are making good choices in their lives to reduce the number of social interactions, to wear masks when they're in public and going shopping, and to be 6 feet from others when they can. And because of that, I'm still very optimistic that we'll never need to use the additional facilities at the convention center or the ranch.
And how long are you asking Coloradans to continue wearing masks?
Well, that's certainly where we need to for now. So, I mean, there's no end date because we don't know what that end date is. Masks are a minor inconvenience for the ability to have more freedom and participate more widely in society and have an open economy. So, again, they're encouraged. People that work in stores have to wear them when they interface with the public for their safety as well as yours. And the countries that have successfully navigated this crisis have gone to a mask-wearing culture sooner rather than later, and that has a significant impact on reducing the spread. Is there anybody who hasn't asked one yet or has a quick second one? We'll go to one more. Yes.
Are you open to looking at new sources of revenue to allay some of these budget cuts, such as the emergency tax or maybe
Well, what we do with ballot initiatives is we've made it a viable pathway consistent with the public health crisis for all of the different ballot initiatives out there. Some cost revenue, some ad revenue. I have no idea which ones will make the ballot, and we wanted to create a pathway that honors the right of the people to petition their government. There are a number of folks that are doing that. Some add revenue, some lose revenue. We're not, I think somebody asked this in a previous, I myself don't look at them until they're actually making the ballot, because there's always hundreds that are filed, and I don't know which ones are serious or not. And like any Coloradan, I have my opinions, but and I'm not shy about sharing them, but I do that after we know what's on the ballot. Thank you all very much. Again, the main message from today: if you have symptoms, you can get tested. COVID-19.colorado.gov. 32 community testing sites, your local hospital. We want to make it as easy as possible for you. Continue to wear masks when you're in public. That life you save could be your aunt, your uncle, your sister, your brothers. It could be your own. And continue to remain 6 feet from others where you can. And together, we're going to get through this and come out the other end even stronger. Thank you.